Okay, good morning, everybody. I am hoping you have all been let in after waiting in the lobby. So welcome to our session this morning on staying well this winter in Leeds. A couple of housekeeping and introductions before we get started. So we'll introduce ourselves first. So my name is Rachel. I work in public health and I have a remit around ageing and sit in the older people's team. And then presenting with me this morning is my colleague Hannah. Do you want to introduce yourself, Hannah?
Hi, my name's Hannah. I also work in public health and the older people's team with Rachel, and my remit's around frailty.
Thank you. And then we've also got Colin, a colleague Colin, with us this morning, who will be able to help with a couple of admin tasks. And hopefully we won't have any problems, but we'll be able to help with some of those. So the session this morning should last about an hour. If you do need to duck out or leave for any reason, then please do feel free. We will be sharing the slides afterwards and the links to any videos or content that we share, so you'll have access to those. This morning's session is being filmed, but you won't be identifiable through it. That's why we're doing it through Skype. So if you have any questions, you should see towards the bottom of your screen there are two tabs, and there's a tab that says Q&A. So if you have any questions, you can click on that tab whilst the presentation is running and ask any questions. Between us, we can try and answer some of those questions, or if there's anybody else in the call who can answer those questions, then please do go ahead. If we don't get a chance or don't get time, we will aim to respond to those either at the end or after the session today. See if there's anything else I need to share. I think that's everything. I don't need to tell you where the toilets are. So we'll get started, I think. So, oh, just one more thing. We are going to be showing a film today as well. So we'll explain to you how to access the film. And I also forgot to say, we've just got the chat function closed at the moment, but any problems, if you use the Q&A screen, we'll be able to flip between the two and hopefully answer any questions. So we'll get started. Hopefully everyone can see the screen that I'm sharing and my slides. So today we're going to talk about winter, and we're going to talk about the impact that winter has on our health and well-being in Leeds, and some of the interventions and services and opportunities we have in the city to support people. We have a public health winter plan, and this is overseen by and led by a winter and health impact group, and in impact group we have representation in public health across all of kind of the key areas. So that includes children and families, older people's teams, teams that look after long-term conditions, team that link in with localities, primary care. There are three main priorities in our plan, so you can see those on the screen. The first one is around prevention and management of winter-related diseases and infections. So a lot of that is around flu. Obviously this year things feel a little bit different, but we'll be going into a little bit more detail on flu and COVID. Support people living with frailty to reduce vulnerability. So we can talk a little bit about some of the services and some of the support that we've got around healthy ageing for those people who are frail or at risk of frailty. And then some work to prevent major avoidable effects on health of cold. So we'll be going through a little bit more about how cold affects our health, and particularly living in cold homes. Typically when we talk about winter, our plan runs sort of October to April time. This year again, a little bit different, and we've had to start some of our work a lot earlier due to some of the risks that we will see in the city around flu, but we can talk along through that. So, as people probably know, some of this is just a recap, but the winter weather, so the cold temperatures, has a direct effect on our health, and that's in terms of things like heart attack, stroke, respiratory disease and conditions, infectious diseases such as flu, impact on falls, deconditioning, people feeling more frail, and we talk about frailty in its broadest sense, and injuries due to some of the cold weather. Winter also has an indirect effect on our well-being. So when we talk about an indirect effect, this is everything that sort of comes alongside cold weather and everything associated with that. So we tend to feel more, a lot of people tend to feel like they get out less in winter, they have fewer social connections. This has an impact on things like depression, and then there's a little bit there you can see just around the impact of our cold homes, but also poorly maintained or poorly ventilated rooms as well. Move on to the next slide. Just to say, if this slide looks, if any of our slides look a little bit small, in the top right-hand corner of your screen, there's kind of two opposable diagonal arrows. If you click on that, it should make the screen and the slides quite a lot bigger. So hopefully you can see that. When we talk about winter, we tend to measure winter work on excess winter deaths. Which is very morbid. In this country, we see around 25,000 excess winter deaths every year. So these are deaths that we wouldn't expect to have normally happened, and these are measured between December and March, and these are compared with the number of deaths for the rest of the year that wouldn't have been expected. So 25,000, these are, ultimately these can be preventable. So there's a huge amount of work that collectively as a system in the city we can work on together to try and reduce these. I don't think we do particularly well. If you look just towards the bottom, you can see that if we compare ourselves to some other countries, we've got Finland noted here, we have double the rate of excess winter deaths. So that demonstrates that we can definitely be working better to try and reduce the number of excess winter deaths. These are extra, and we know that, and these are related to cold temperatures, but like I said, majority of these are for living in cold homes and the spread of infections such as flu. I shall move on. There are certain groups who are more at risk of poor health and poor well-being due to cold weather, so there is a whole list here on your screens. Ultimately, we tend to focus on people who are older, people who are living with frailty, people who suffer with long-term conditions, people who live on their own, pregnant women, young children and their families, anybody living in poor housing, cold housing or damp housing, people who spend a lot of their money or income on keeping their home warm as well. There are probably more groups than listed there, because you'll see the bottom bullet point says other groups who may not access services. So we can all be affected, but these are some of the groups who are more affected due to cold weather. We'll move on. So most of our excess winter deaths in this country are not caused by extreme temperatures. They're not caused when we have huge snowfall, and they're not caused by people sort of dying of hypothermia or anything like that. They're caused with normal winter temperatures. So I think our average winter temperature when it drops to its lowest in this country can be around 3 degrees, and often our normal winter temperatures are between about 5 and 8 degrees. So when the temperature drops below that, that's where we're seeing people experiencing poor health. We can't get away with anything these days without having an additional slide for COVID. And I'm sure many people, we could spend a lot of time elaborating on this slide, but many people this year are going to have worse health due to the impact of COVID. We can see that people can suffer with COVID and flu at the same time, and there is a slide specifically making reference to this shortly. We will see COVID and flu circulating at the same time in this country and in this city, so there's a lot of work we can be doing to try and prevent that, which we'll talk on. There are obvious increased pressures on the health and social care system, so we need to really work together to try and reduce the impact of cold so that the health and social care system can continue to support other people in other ways. I'm sure we all feel definitely the second time round being in lockdown might feel quite different compared with the summer when we could get out for walks. It was light when we finished work, we could sit out in the gardens, and we probably had a completely different experience. So I think the feelings of lockdown second time round, with it being winter, with it being cold, is going to be really, really quite different. So there are definitely additional risks that we will be facing with COVID and winter compared with the summer. So there's a little bit about temperature. I just went downstairs before this started and put the heating on because it was cold. Public Health England recommends that our indoor temperatures, so in our homes, in our workplaces, in the places where we are indoors, which is majority home at the moment, should be between 18 and 21 degrees in the room that we spend most time in, or that we're spending time in. When the indoor temperature drops to 16 degrees or lower, that's where our resistance to lung conditions declines. When the temperature drops all the way down to 12 or lower, that's where we are all, people who are susceptible are more at risk of heart attack and stroke. So we're going to come on a little bit more of people who may struggle with paying for fuel bills and energy efficiency, but it's really, really important that we really focus on how to support people to live in safe and warm homes. And there's an infographic there that just explains that a little bit more. And we'll potentially talk through some of the resources that are available at the Public Health Resource Centre and how people can access these to help people stay warm in their homes. So move on to, so what we're going to talk through today, there are, according to Public Health England, there are 9 things that matter. There are 9 high impact evidence-based interventions that we can all be aware of, we can all make good use of, promote, support, or have positive conversations around to support people to stay well during the winter. So we'll talk through each of these, and we'll talk through how these link to services and resources that we've got in the city that you can make good use of. And we had a quick look through the list of attendees just as you guys were waiting in the lobby. So we are conscious that some of you work for some of the services that we are going to be talking about. So if anybody does have any questions, it would be great. We can hopefully link up services to people as well if they'd like more information. So the first one that we're going to talk through is flu and getting the flu vaccine. So this is the most effective intervention to support people in winter around preventing flu, but it's particularly important this year due to the co-circulation of COVID and flu. I'm going to show you a video because it explains things a lot more articulately than I can.
For most healthy people, influenza, otherwise known as flu, is an unpleasant but usually self-limiting disease. However, children, older people, pregnant women and those with long-term health conditions are at a particular risk of severe illness if they catch it. This year, with COVID-19 in circulation, it's more important than ever that eligible groups are vaccinated to protect them from flu and to support the resilience of the health and care system. The flu vaccine prevents people from getting the flu and is the best protection from the flu virus. Additional cohorts have been added to this year's flu programme, which means that more people than ever will be eligible to receive the vaccination free on the NHS. More than 30 million people will be offered the vaccine this year. If you fit one of the following groups, we would encourage you to have your vaccine to help protect you and your loved ones this winter. Aged 65 and over. Pregnant women of any age. Those with certain medical conditions, such as asthma, a long-term respiratory disease, heart failure, a chronic heart disease, diabetes, or a learning disability. Those living with someone who's at high risk of coronavirus on the NHS shielded patient list. Children. This includes those aged 2 and 3, all those in primary school and in Year 7 at secondary school. Those living in long-stay care homes or another long-stay care facility. Frontline health or social care workers, those aged 50 to 64. However, note that this will take place later in the year, November and December, and will be subject to vaccine supply with priority given to those in at-risk groups first. A full list of all those eligible for the flu vaccine this year can be found on the NHS website by searching flu. Please note that due to the COVID-19 pandemic and guidelines in place, GP practices are offering alternative methods to how they have historically delivered their flu clinic, with the majority of flu vaccine appointments being pre-bookable this year. For more information, please visit www.nhs.uk/conditions/flu or your GP practice website for more detailed information. In addition to general practice, GPs, community pharmacies, maternity services and school immunisation teams will be able to give the flu vaccine this year.
So that film explains a little bit about eligibility and the flu vaccination this year. I'm just going to move on to the next slide and the next one. So we do have some research or some evidence coming out at the moment around the co-circulation of flu and COVID. So the evidence so far suggests that if somebody tested positive for both, the risk of death more than doubles. This is a really morbid slide to read through, I'm afraid. And if somebody has co-infection of the two viruses, the risk of severe illness greatly increases as well. And then most cases of co-infection were in older people. So this is why we really, really need to ensure that everybody who is eligible accesses the flu vaccine this year. Whenever we talk about flu, we get tons of questions, so I'll try and preempt some of those questions. Everybody this year who is eligible for the free flu vaccine will or should be receiving a letter, and the letter comes nationally inviting you to have your vaccine and explain the vaccine details. Obviously, due to the situation we're in, primary care, so GPs are having to amend the way they deliver their usual clinics, so they can't have queues of people, they can't have lots of people in at the same time. So people may have seen at their own GP practice or out and about in the community some real differences in how things are being delivered. Each GP practice as well is prioritising groups and inviting groups in as they see fit. So anybody who's eligible, they'll invite them in to come through. But the big message at the moment is you may be asked to wait. If you are asked to wait, that's simply because primary care are working through their lists and trying to ensure that everybody is getting their vaccine and is able to get it safely. They're also battling against vaccine delivery, so the vaccine is delivered in batches. As I'm sure people can imagine, the demand this year for the vaccine is greatly increased, but there is enough vaccine in the system, so if you are asked to wait, it's okay, there is enough vaccine and people will be invited. Obviously, lots of people, I'm just trying to not read the chat, sorry, I'm just going to try to close that. Lots of people have lots of questions, so we would just recommend checking with your GP website to just check any availability. But your GP should also be able to advise you on when you may be able to have the vaccine. We can also share, there are some resources that answer the questions why you're being asked to wait. So if you are working with communities who are asking lots of questions, we can share those resources so that you can provide the correct information. There is a social media campaign this year called Just the Flu, which is why that film was called Just the Flu. So there is some social media posts which you can retweet or repost, and we'll share that through our age-friendly social media, but we can also send some information to everybody who's been on this call as well. And we've also developed some further messages just to explain that you may be asked to wait and that there is enough vaccine available. I think on that film it also talked about the 50 to 64-year-old cohort. So people may have seen on the news that the people aged 50 to 64 will be able to have their vaccine this year. Previously it's been 65 plus. This is all dependent on vaccine delivery, and this is something that will be called nationally. So once that's announced, I think on the video it says November, December time. Once that's announced, those people will receive invites to go and get their flu jab as well. So that one's a case of waiting for an invitation to come through. You'll also have seen on the on that film that anybody who lives with anybody who was previously shielding or on the NHS shielding list will also be able to get their flu vaccine, and that's being worked through at the moment as well. GPs are often offering that opportunistically, so just to be aware of that as well. But we can circulate any further support and guidance around flu. Just going to jump back, check I've covered everything from those slides. So I'm sure people have heard of hands, face and space. So this can also support with flu, and this is just a reminder on resources that are available to trap germs and just to promote those hands, face and space messages as well. I'm hoping I've covered everything on flu, but I can take any questions on flu as we go along. I think that takes you to the end of my slides, and Hannah is going to take over as presenter and go from here. I will mute myself. Thank you, Hannah.
All right, let's see if this works. Yes, hopefully it has. So I'm going to pick up from where Rachel left off with the rest of those 9 high-impact evidence-based interventions. So the second one is about checking medicines. So kind of linked to that as well, if someone's on regular medication, they should normally have their GP practice getting in touch with them for an annual medication review. However, if they haven't, you can call the practice as well or support them to call the practice. I know lots of people are kind of taking on a bit of a health advocate role during COVID with trying to speak to primary care. So that's important to make sure that people are on the right medications and are taking it properly. And then also reminding people to account for winter closures. And then again with COVID, if people need to isolate, that's something that we should be talking to people proactively about. You can also speak to local pharmacists about medication, and some pharmacies are delivering medication for free, so there's no delivery cost. That might be a good option for people to explore as well, particularly over the next few months, kind of with winter and isolating and things like that. The third intervention is about keeping the inside of your house warm, which Rachel's already mentioned, with those different things that happen as the temperatures get colder. So we should be keeping our homes between 18 and 21 degrees, and we'd encourage people to do other things as well, like wearing layers and trying to keep active to make sure you stay warm at home. It says on there if you're doing home visits, which I know lots of people won't be doing home visits. So something that you could do instead, perhaps when you're having phone conversations with people, or if you are using Zoom and video chats, just kind of dropping it in about if their homes are warm enough, if they're feeling warm enough, and having that conversation as well, as a gateway to make sure people are staying warm during winter. Linked to that then, our fourth intervention is about seeking help if you're struggling with fuel bills or energy efficiency. Hopefully people know about Home Plus Leeds. It's a service aimed at enabling and maintaining independent living through improving health at home. They also do a lot of work to help prevent falls and other cold-related health conditions. There is eligibility criteria, but there is a whole range of things that Home Plus Leeds can help with. And just to say as well that this is a collaboration between different organisations. So it's Care and Repair, Age UK and Groundwork. So they have a whole host of resources and kind of information and guidance that they can help people with. So it could be things like emergency heating repairs. They do home assessments, which at the moment I think is being done over the phone mainly because of COVID. But then if contractors are going into the home, they do have PPE. They'd ask the person to stay in a different room if possible and kind of do social distancing. So they are still working during COVID times. There's also a lot of work that they do around cheaper energy deals and energy saving advice and equipment, and draft proofing and insulation measures. So there's a lot that they can support with. So we would definitely recommend people get in touch with them, and they can kind of direct people to the right part of Home Plus Leeds. So there's a number on there that you can call, or you can also check out the website on Care and Repair. And then also linked to that, if people are struggling with paying things, you can also get a benefits entitlement review with the Welfare Rights Advice Line. Oh, too many words on a Monday morning. But yeah, so that's that one about kind of making sure that people are able to keep their homes warm as well. The next one is linked to that again then, so about keeping active, and then seeking support if people are worried about a fall. So I'm sure we all know regular physical activity strengthens muscles, improves balance, it's good for your mental health and well-being as well, and there's a whole host of things that people can do. Like Rachel said before, this wave of lockdown is probably a bit harder because you might not want to go out as much, it's cold and dark, but there's loads of things that people can do at home as well. And Active Leeds has a really good offer with their health programs. There's lots of different resources there. There's stuff online. There's some YouTube channels that you could look at. But then there's also printed resources with kind of different levels of physical support, physical activity that people could do. And then similarly, Home Plus Leeds also do things like rails and other support to prevent the risk of falls if that's something that people are concerned about. There's other campaigns as well nationally. So there's Sport England. They have the campaign Join the Movement, and that's got its own online hub, and that's got a range of home workout options as well. There is a specific campaign for people managing long-term conditions called We Are Undefeatable, and that's got brilliant inspiration and ideas. Then there's also things like older adults can visit the BBC Sounds, and there's an exercise program on there that will help around maintaining independence and poor health and things like that. So there's a lot happening around physical activity for all different ranges and motivated levels and whatnot. Then Active Leeds also have worked with Public Health to develop this Keeping Well at Home booklet. It's available digitally, so you can download it yourself, or you can also order physical copies from the Public Health Resource Centre, which I'll talk about in a bit how you do that. And this is a really easy read document, so it's quite public facing. It's easy to read, and it has advice on exercises, preventing falls, and healthy eating as well. They were distributed through neighbourhood networks, so you might have seen it already, or people might have already had copies of it. And then there's also a webinar there with some of the support messages and helping you promote that on that YouTube link. And like Rachel said already, we'll share these slides so you can have the link to that.
Can I just jump in, Hannah?
Mm-hmm.
Thank you. So just to let people know this resource, it is, I think, it's about 23 pages long, and it has diagrams of cartoon type images, animations maybe, of activities that are safe and effective to do in the home for somebody who is staying home and might not be engaged in activity at all. These resources are free, and as Hannah said, they are available either digitally or you can order copies through the Public Health Resource Centre. And the reason I'm sharing that is I believe I ordered some, and I think they've had 40 odd boxes delivered, so I might not be in the good books. So if you would like large numbers of this resource, and you could distribute, depending on where you work or what you do, if you're able to distribute, if you're pulling together Christmas packs or resource packs or activity guides or anything like that you're popping through doors, or food parcels or anything like that, and you want to include this, then please do get in touch with the Resource Centre. I'm sure they and I would welcome. I mean, as we know, they're better in people's homes and in people's hands than they are in boxes. So I really would recommend that. Just to let people know as well, when we developed this, we did it with the University of Greater Manchester and a couple of other organisations to make sure that it was evidence-based, but it was also tested with groups of older people as well. It's not specifically designed for older people, but it is for people who are a little bit less mobile. So we did make sure we had that local insight, so that we used the right language, the right terminology, and the right images that resonated with those particular groups. So just to push there, if you have any way of distributing that, there's also some space in there for people to write their own goals, particularly during lockdown this time round. I don't know if anybody else is doing it, but I've got my goals this month, so other people might find that quite helpful. Thank you, Hannah. I'll mute again.
Awesome. So please do go collect those. I'll tell you in a minute how to collect them from the Resource Centre. So then our sixth intervention is about having hot food, drinks and snacks. So we know that supporting people to have regular hot food and drinks helps people keep hydrated, healthy and warm. And normally we'd say that food's also a really great opportunity for socialising and sharing or learning new skills. I know that's difficult at the moment, but there is lots of kind of innovative stuff happening as well, whether that's Zoom calls or calling each other to share recipes and things like that. So we are still promoting hot food and possibly exciting ways of kind of working around being at home whilst also trying to socialise. Anyone working with older people in Leeds can also access the free Improving Nutritional Care training for older people. I think that might be on pause at the moment whilst we figure out how to do it online. Rachel, come in if you know.
I can chip in there. So the training is delivered by the Community Dietetics team in Leeds Community Healthcare. They are just finalising, or were last time I checked, online delivery and also resources as a refresher as well. So if you did the training a year or two ago, how you can have a refresh without having to go on the training again. If you work for Leeds City Council, that should be bookable through PALS. If you don't work through Leeds City Council, but you have access to PALS, then you can book on there. If neither applies, so if you don't work in Leeds City Council, you don't have access to PALS, we will make places available through the Public Health Resource Centre. So we would say watch this space really for places there. We can share the link when we share the presentations to where we land our training offer, and the details to book on there. But if you have any problems accessing that, or there's a real need in your organisation, then you could drop me a line and I can try and link you up with that training. If I don't mind, Hannah, just mentioning there as well, the COVID-19 malnutrition helpline. So this again is delivered by Leeds Community Healthcare. and it's a direct phone number if you are worried about somebody in terms of malnutrition or dehydration or food in its broader sense, or you're worried about yourself. So somebody can call this number themselves for advice, or you can call on behalf of a service user or patient or somebody you work with, and they can give, it's clinically based advice, but it's kind of quick advice really. If you're worried about somebody and you want to know what food projects are local to you, or if you're worried about somebody in terms of access or cooking or anything like that, they should be able to signpost and link and provide sort of generic advice as well. But it does take into account the obviously the impact of COVID and those people who are staying at home, so should be able to link you up with the schemes we've got in the city around foods. I'll hand back to you, Hannah. Sorry. Thank you.
Okay. And I think also linked to that, there's lunch club providers. Some of them are still continuing during COVID, and I know lots of third sector and neighbourhood networks are trying to do things like hot food deliveries and things like that. So if you aren't aware, Leeds Directory is a good place to go to find out what's happening in different areas of the city, or getting in touch with neighbourhood networks and stuff like that. But you can also get in touch with us if you're not sure about that. But I know there's a lot happening across the city to try and make sure people are getting hot food over the winter periods. So our seventh intervention is about asking for help. Some people might need additional support or resources, things like personal alarms, sensors in chairs, falls alarms, things like that. If you think that might be appropriate, you can ask for an assessment with the Leeds City Council Contact Centre, or visit or contact one of the one-stop shops, and then they will be able to support you through that and pass on information to adult social care. There also have been the community care hubs that were established across the city to help with COVID. Lots of those are linked to neighbourhood networks and other third sector organisations, and I believe that they will be going until at least December. So for at least the next 2 months, those will be around as well. I'm sure lots of you have engaged with them. They've been brilliant over the past however many months, but those are an additional resource. If somebody needs a bit more help, if you contact them, they'll be able to support you with that as well. So then number 8.
Sorry, Hannah, I was trying to unmute as you were talking. Just to say, there is a central phone number and website to find out your local community care hub. So there's a community care hub in every ward in the cities, I think. So there's 33 of these. These are local organisations that can support with befriending calls, food, anything like that. So we can share the main phone number or website in case you're working out in the community and want to link to your local community care hub if you don't already know about them. Sorry, Hannah, I was unmuting.
No, that's fine. So then number 8 is linked to that, about connecting to the local community. So social isolation has a negative impact on our health and well-being normally. Again, things are a bit weird this year. And we know that in normal times, there are about 37,000 older people who are socially isolated. I know there's been lots of work done during COVID where people have found new people, and there've been kind of new referrals through the proactive work that we've been doing, but still kind of there's a lot to do. So Leeds Directory is a really great place to go, and they list local events and activities in your area. They're also trying to keep up to date with COVID things, so if things have stopped or started, and similarly, if you know of something that's stopped or started or isn't on Leeds Directory, if you let them know, they can update that as well. We'd normally suggest that people attend local groups and try new activities, take up new hobbies and things like that, which we would probably still say to try and do during COVID, perhaps in a different way. But yeah, trying to keep people connected to local communities. And linked to that, neighbourhood network schemes are a brilliant way to do that. They're community-based, locally led organisations. Lots of them are focused on older people, but some of them are more across the life course, but supporting people to live independently and proactively participate in their communities. They are quite different across the city, so have a look at kind of what's in your local area, but there's a lot going on. And during COVID, sorry, I keep mentioning COVID, there's also a lot of work being done across the city with digital inclusion. So you might have been involved with or heard of the 100% digital programme. I think they're working a lot with neighbour networks as well. There's support with training for staff to help older people get online. They have a lot of equipment that they're loaning out, kind of iPads they can give out to people. And yeah, doing support around that to make sure that people are keeping connected and maintaining their health and well-being over the next few months. Mental health support. So Mindwell is a single point of access for anyone working or living in Leeds. They have a whole host of information, whether it's about support services available in Leeds, information on common mental health conditions. They've got different videos and self-help things, and then also help for what to do in a crisis or a mental health emergency. So I would definitely recommend either accessing that yourself or supporting people to access that if they're struggling, particularly over winter as it gets kind of dark and cold. Yeah, the Mindwell is a brilliant place to support people to go to for that. And then our 9th and last intervention is about being prepared. So knowing that there's a cold snap on the way helps us all be a bit more proactive and get things in place. And the Met Office can keep us up to date. If people aren't online, we would recommend that people check out the TV, radio, and then you can register to receive email alerts from the Met Office. And again, we'll send this link out, that you can get weekly updates from the Met Office, so you know for yourself, but also for any people that you're supporting, if there's a cold snap coming, consider getting some of those interventions in place so that we can support people during winter. Then finally, now that we've been through all of the 9 interventions, we would ask you to take us back to your teams and get these messages out there. And to help us do that, we've got the Workforce Winter Friends campaign. So becoming a winter friend, you're able to support your colleagues, service users, friends and families with these interventions that we've gone through. And rather than asking everyone to come on a webinar, we've got an animation on YouTube that lasts about 15 minutes, kind of talks through all of these. So it's quite an easy way to share. You could show them in a team meeting, send them out to your organization or whatever, but that's an easy way to get these messages out there, and hopefully all of us can try and avoid some of those excess winter deaths that Rachel talked about. There is a whole host of resources at the Public Health Resource Centre around winter, and some of the service leaflets for the things that we've talked about. If you get in touch with the Resource Centre, there's the email address on the screen now, or if you call them, they are still doing collection of resources. So if you give them a ring, and then they will give you a time slot where you can go to Tech North, which is in Chapel Allerton, and you can pick up all your resources from the reception, and everything is very COVID secure. We've been reassured. And you can also pick up a pin and a fuel tote bag, which, like Rachel said with the other leaflets, please do go and pick these up because we have quite a few boxes of them. So yes, there's loads of resources, and beyond winter stuff as well, the Resource Centre has a whole host of resources for all sorts of things. So we'd recommend, if you have a look at the website or give them a ring, there is a whole host of things that might be helpful for you in various roles.
Just on that, Hannah, if people haven't seen, on the Resource Centre website, there's a specific page that's been set up for anybody working in Leeds around health and wellbeing, which is probably all of us, specifically around COVID. So any resources or document or guidance or anything that may be supportive around COVID, there is specific pages on there. So I can't remember exactly what it's called. It should be quite obvious, but you can go in and it's broken down to topic areas. So it may be mental health and wellbeing linked to COVID. It may be alcohol and drugs linked to COVID. So you can click into each of those, and there's all sorts of things that are landed there, so that hopefully it's all in that one place and is helpful. I can talk through the next slide while I'm going if you want, Hannah.
Thank you.
So we've talked about the workforce Winter Friends work, which is as simple as watching a 15-minute clip. What we've also done is, following some insight over the last few years, is around supporting people in the general public, in their own homes, their own communities, to be Winter Friends and to support other people locally. So this is the look and feel, this is the branding of the public-facing Winter Friends campaign. There is a website which we'll send with this link, and anybody can go onto that website, and there are a whole host of public-facing resources that you may wish to use or promote in communities. And this is all about supporting people in your own communities. So if you've got a neighbour, for example, you haven't seen them around as much. I shouldn't say that in COVID, should I? But you've got a neighbour you I don't know, they've had the curtains closed a little bit longer than normal, or you've had less of an option to sort of chat to them in the street. There are resources you can download, you can print, you can pop through people's doors, calling cards, there's recipe cards, there's all sorts of opportunities, and this is all about helping each other and being kind in communities. We can do it in our work setting. This is about taking it home. There's also through that website you can request to be a Winter Friend, and you can be sent a pack, and it's got lots of nice cute little resources to continue to remind us that we can all do things in our own neighbourhoods. So if we pop into the supermarket and we've got somebody living nearby who might be older and frail and less able to get out, shielding or whatever, isolating, to maybe offer to grab them a tin of soup, or to just encourage them to make sure that their home's warm, those types of things. So we've got the workforce animation for anybody in work, but we've got the public facing campaign as well, which we will start to promote this week, I believe, through social media channels. So anything you can do to support Winter Friends, #WinterFriends, or anything like that, then please do so, but we'll send the links to those. Thanks, Hannah. I don't know who's next, actually. I'll go back to you.
So then to help with that as well, we've developed some winter planning checklists. So they're checklists basically that go through those interventions that we've had, that can help people have those proactive conversations. So they've got some questions that you could ask, and then some resources as well, and things to check off to just say, yes, I've had a conversation about this. Those are available on the Public Health Resource Centre website. So the link there is what Rachel was talking about, the resource centre, and then COVID-19 campaigns. So those are all there online for you, or you can also get printed copies from the resource centre, and hopefully those are kind of a proactive way to have those conversations with people. And then in terms of other resources, Rachel, I don't know if you want to take this one.
I was just going to say on the checklists, thanks Hannah. So the checklist on the screen at the moment is aimed at adults, working age adults. We also have the same checklist if you're working with children and families. There is actually a session very similar to what we're delivering today in the next few weeks, which is aimed at anybody working with children and families specifically. So although the kind of the overarching interventions are very similar, there's different services or different support available for children and families. So just to say there are two, and like Hannah says, they are a prompt, they're a positive conversation support tool basically if you're working with somebody. Sometimes people like things to work through, so it's structured, so they are available. So Public Health England over the last few years has had a campaign called Help Us Help You. And there are a few different strands around Help Us Help You. The one that we were always interested in was Help Us Help You Keep Well This Winter. And there are a number of resources anybody can order through Public Health England resource pages. A lot of things we do have locally at the Public Health Resource Centre, but if you're ever looking at much broader work from Public Health England, you can register and have access to all of their campaign resources to download and print. They also have social media strategies and anything else linked to well, any Public Health England work really, so you can register and access those. Just in terms of from a strategic perspective, depending on where you work, what you do, you may be interested. Public Health England and NHS England release every year a cold weather plan for England. This is complemented by NICE guidance on excess winter deaths, so it's evidence-based, and it basically gives you the strategic recommendations and kind of overview from that perspective. of things you can implement, or things that can be implemented kind of system-wide. So it does give you that much broader overview. That's released every year, and I believe it's out for this year. I think it came out a week or two ago. So we will just check that link. If it should be on that link if it's been updated, but it's very similar every year. It'll obviously have a COVID focus and COVID lens on it this year. I believe that is the last slide, so I can jump over, she says, onto the question and answer board, and not too many questions. I guess what we can do is, it looks like Colin has turned the chat on. So if we do have, sorry Donna, hopefully you got sorted. There was a question about flu, but I can follow that up separately. But I guess in the last 10 minutes, if anybody has anything they'd like to ask or share through the chat, we can open that up. If there's anything we've particularly missed, or anything that anybody would like any further information on, please use the chat functionality now to ask that. And if we don't have anything there, that sounds like we've got through it in 50 minutes and hopefully have covered those 9 interventions. Our ask really after this then is to use the clip with your teams, the animated clip, share that in any team meetings, or send that out to colleagues, volunteers working out and about in the community, so that everybody is up to speed with the 9 high impact evidence-based interventions. To promote the public-facing Winter Friends campaign, we will send a link out with these slides, and to familiarise yourselves with some of the websites that we've talked through and some of the other opportunities that we've talked through as well. I'm just looking at messages that are coming off as well. So it looks like microphones, if anybody does want to ask a question, I think Colin's turned microphones so that you can unmute yourself. So if you do have any questions, you are welcome to ask them verbally or on the chat. Please go ahead. And if everything stays quiet, which it has done, we will probably take this opportunity to thank everybody for joining us today. And if you do have any queries, please do follow up with us, but we will make sure the information, resources, slides are shared as you registered through the Resource Centre. Is there anything else you'd like to add, Hannah?
No, just thank you guys for coming on a Monday morning. I'm sure everyone's very busy, but hopefully it was helpful. And yeah, we'll send everything through.
Thank you, and go check your thermostats and make sure that your home is nice and warm for the rest of the day. So thank you very much, everybody. We'll send things on and enjoy the rest of your day. And thank you to Hannah and Colin as well for keeping us on track. Thank you. Bye-bye.